Imagine living without pain. No addicting drugs, no steroids that can do more harm than good, and no surgery. For millions of people who suffer from chronic pain, that technology is available today.
It's one of these procedures where it sounds too good to be true, but it isn't.
Whether you're 26 or 62, I would recommend this to whoever had the problem. Because like I said, it's done things for me that I never thought possible and easier than I ever thought possible.
It's very simple and safe, and that's what really turned me onto it.
For me, PRP turned out to be a great alternative for surgery.
There's no trauma involved. It's essentially painless, it's efficient, and it works.
I have found very little pain that could not be injected and treated with the PRP. What does this method entail? Very simple process. We draw your blood, we centrifuge the blood, and we then go into the blood to extract the mesenchymal stem cells and the platelet-rich plasma. To this, we add bioenhancers your body utilizes for healing. We infuse that into the area of pain. We're able to do this simply in the office in about an hour, and in 3 or 4 days, you're getting tremendous relief from that pain.
About 8 weeks out, I was preparing for the Nevada State bodybuilding competition and had a tear in the inner head in my hamstring. Dr. Smith offered to try a PRP injection with me, and actually I had heard about it because Tiger Woods and Kobe Bryant and Andrew Bynum, a few famous athletes, had already got this procedure done, and it was fairly new, and I heard very good results with it, and I got actually pretty amazing results to where I was back in the gym in just 2 weeks after a hamstring tear. That's a very rapid recovery, and it's very simple and safe, and that's what really turned me onto it. It really promotes the natural healing process of your own cells without any drugs or any surgery. I have actually probably better use of the one that was injured than the one that was not, just normal wear and tear and everything, but it feels great, 100%.
When I was 24 years old, my little cousin came to me. He's like, "Do you want to play a pickup football game?" And I said, "Yeah," because I love football. I played football all through high school, never gotten injured. And this one time with my cousin, I ended up actually tearing my ACL. I didn't follow through with any of my aftercare. I was 24, I thought I was gonna heal, I thought I was invincible. But turns out for a solid 6 years, I walked with a pretty heavy limp, which led to some substantial back problems. So I was a little skeptical. It sounded a little too good to be true. Sounded too easy, considering all I had heard before was get ready to have more surgery or get ready to be in pain the rest of your life. Just to have a simple injection do it just seemed way too easy. I had to have 2 injections. After the first one, I'd say I went to like 85%. All my back problems went away with the first injection. Then after my second injection, that's when I got to 95%. It's given me the ability to act my own age again. It's done things for me that I never thought possible and easier than I ever thought possible.
I'm 65 years old. 30 years ago, I've had multiple surgeries, but 30 years ago I had a doctor who was doing a bone scan tell me then I had the bones of an 80-year-old woman. Well, that was 30 years ago. Now I'm kind of like bone on bone, and I have discs that aren't where they should be, and it's just pretty well messed up. I tried pain medications, but all that did was just mask the pain. It didn't cure the problem. Anybody that's ever had any kind of back pain, they know what that pain's like. No pun intended, but it was worth the shot. As far as the procedure itself, I've had worse manicures. They deaden the area with lidocaine, which is not painful, and then the doctor injects it. And you don't feel anything other than relief. And I can't say enough about it. It's one of these procedures where it sounds too good to be true, but it isn't. The way things are nowadays, everybody, of course, they need to watch their money and the economy and all of that. This was one of the best things I could have done for myself. And all I can say is, don't cheat yourself out of life. You're worth it.
2 2 years ago, I began to notice I had a problem with my left hip and my knee. And as I danced, it became more and more of a problem. There was pain in the knee, there was pain in the hip. I had been dancing for about 20 years, but I could not compete because that's a situation where you have to dance at a high level for a continuous period of time, and my hip and my knee would just not allow me to do that. I had gone to my athletic doctor, and I had gone to an orthopedic surgeon who suggested that I need a hip replacement. And I wasn't quite ready to deal with that yet. So I began to take treatments with Kathy, and my fears about needles were pretty much put to rest. It was not painful, it was not traumatic at all. Very straightforward process. I'm at the point now where I can pretty much dance full out without any pain. And my wife and I are planning to start competing again soon, so it's been a very successful treatment for me.
I have multiple issues that have come about over a period of about 4 to 5 years, but my main concerns were my knees and my lower back, and I was at a desperate stage, and PRP seemed to be the way to go. My orthopedic surgeon actually said that he would not do another knee surgery unless he did the PRP. So I agreed with him, and I was disappointed with the result. So we then went ahead with yet another surgery on my knee. I couldn't walk up the stairs, it'd just give way, and I had to pull myself up. So I've known Dr. Smith over the years, and I have faith in her as a person, as a doctor, and I knew that she would not steer me wrong. So I was quite happy to try it again with her. My medical situation today after the PRP treatments I've had with Dr. Smith is, for me, a godsend. She's amazing at what she does, yeah. And she's so sweet with it. Her whole attitude is just lovely, yeah.
Well, I was riding my mountain bike, went over the handlebars, landed on my shoulder, ended up with a 3rd-degree AC joint separation in my right shoulder. I was immediately taken to the ER, who told me that I needed to go see an orthopedic surgeon right away. I saw him the next day, and he immediately told me that I needed surgery. I researched my options a little bit more. I discovered Dr. Smith's PRP injections, decided to give that a try. I went back to the orthopedic surgeon 3 days before I was scheduled to have the surgery, and he told me that he had never seen anybody with my type of injury be able to move my arm the way that I could. That was approximately 1 week after the injury. I had full mobility and rotation of my arm. It probably would have been about $5,000 for me to have that surgery, plus 6 to 8 weeks out of work. I couldn't really afford to do it. I did one more round of PRP injections, and I would say I'm probably at 95 to 99% of where I was before the injury. I live a very active lifestyle. That's what gives me enjoyment in life. For me, PRP turned out to be a great alternative for surgery. It was well worth it.
We are continuing to explore new horizons in the management of pain utilizing the PRP therapy. I have treated fibromyalgia with this, tendon ruptures from bone with this. I've treated knees with no cartilage. In every case, we've had pain relief or immense improvement in pain. I also have treated backs, necks, sciatic nerve pain, neuropathy, muscle strain, muscle inflammation, inflammation in joints. Osteoarthritis is also another area that is well treated with PRP, and it is believed that it will halt some of the progression of arthritis that these patients experience. We utilize your body, and so it's all natural to you. You don't have to worry about would you have a reaction to it. You won't. And with a proprietary ingredient, we are then able to augment your natural healing response up to 500-fold its natural ability. But this is, keep in mind, your body healing you.